So how do you think COVID has affected the deaf community? That's a great question, to be honest. I think the deaf community being a very equal community, and I think isolation there, we've suffered because we're isolated. COVID, I think, has affected us doubly more than anybody else. Mask wearing has affected us because we've got barriers there to see lip patterns and things like that, so that makes communication quite hard. It can be quite upsetting, not understanding what's going on, which then affects mental health. Social events haven't been held anymore because we always get together and we chat. It's such a face-to-face language. There was always gatherings held. And also being a deaf person, being locked down at home is very isolating. Your mind can then play games. You tend to spiral a little bit. I think you need that social interaction, especially for mental health, especially going to see a counsellor and stuff like that to make yourself feel better. We go to deaf events for that mental well-being as well. So it has had a major effect on the deaf community. Well, yes. I think it has affected the mental health of the deaf community as a whole. And I think that's because, I guess it also depends on your age bracket that you're in. I think the younger ones there utilise technology and know how to use it. The older ones don't necessarily have those technological skills to engage with them, so they need that face-to-face interaction to be able to sit down and talk to each other. But because of COVID, we were isolated at home, I think a lot of those elderly ones had that frustration, and that led to a bit of depression because they are lonely originally, but then when you put the advent of COVID on time, it sort of exacerbates it almost 500% because they don't have the opportunity to go out and meet their friends. So I'm looking at the deaf community and mental health. I think COVID had a big impact on us. The community became very isolated, very withdrawn. They couldn't get access to much information there, so they would Google a lot of stuff and they could find supports and things like that. So access to information is very important, whether it be a deaf or hearing person there. But we need to definitely refer more information for the community.